Okay, in this video I'm going to go over the bones and the ligaments and essentially the joints of the shoulder. So to start on your joints, this right here is the glenohumeral joint. So as the head of your humerus, which is this, comes in and attaches to the glenoid, which is that part of your scapula, it makes what's your true shoulder joint, your glenohumeral joint. Okay, then you have your acromioclavicular joint, which is easier to see if I tip the body up, but it's where your acromion, which is this, comes with your clavicle, which is that, and makes the acromioclavicular joint. Then we have your sternoclavicular joint, which is this little area here, where your sternum, specifically your manubrium, comes and attaches to your clavicle, and that makes up your sternoclavicular joint. Then you have one called an articulation, and it is your scapulothoracic articulation. So it's hard to really point to, but right here where your scapula sits on your rib cage, it creates a floating joint called an articulation. Okay, and all of those joints are connected with ligaments. So we're going to talk first about the glenohumeral ligaments. So we'll have your glenohumeral ligaments here. These are all glenohumeral ligaments. Okay, they all have their own names, but as a whole they're called your glenohumeral ligaments. And then we have your articular capsule, which I can highlight there, and you can see how it comes up to the top of the shoulder right here. That's your articular capsule, and it just surrounds the entire glenohumeral joint underneath of your glenohumeral ligaments. Okay, so then you have your coracoacromial. So it's going to take your coracoid up to your acromion, like this. So you have your coracoacromial ligament, which attaches those two bones together. Then you have one called your transverse humeral, and that goes across your greater tuberosity and your lesser tuberosity, holds your biceps tendon down in the bicipital groove. So that's transverse humeral. Then we have the coracohumeral, and it's going to go from the coracoid process to the humerus, and that one sits right there. Then you're going to have two in your coracoclavicular ligaments. You have a trapezoid and a conoid. So this one here on the front is your trapezoid, and that's your coracoclavicular ligament trapezoid portion. Then back farther, you have your conoid portion of your coracoclavicular ligament. Okay, then lastly, to create the AC joint, we're going to have the acromioclavicular ligament. Okay, then let's talk about some of the bony landmarks on the different parts. Okay, so this is your greater tuberosity. This line here is your bicipital groove. This is your lesser tuberosity. Okay, so those are the bony landmarks on your humeral head. Then down here you have your deltoid tuberosity. So if you imagine the deltoid muscle coming down and attaching, somebody had deltoids there, they come down and attach to the bottom at your humeral, on your humerus at the deltoid tuberosity. Okay, then if we talk about the ones on the scapula, we talk about the different parts of the scapula. Okay, we already talked about the glenoid, which is this little space here. Okay, that's where the head of the humerus comes in and attaches to the scapula. Okay, then we have our acromion, which is this right here. This is your acromion. And then the spine of your scapula is a continuation of your acromion. Really, your acromion is a continuation of the spine of your scapula. So you'll see the spine of the scapula and then the acromion here. Okay, and then the superior angle is this. The inferior angle is this. The medial border is this side. Lateral border is this side. Okay. So that pretty much completes the bony and ligamentous anatomy.